for joining us. This is our San Marcos Chamber Power Lunch. My name is Rick Rangaitis. I'm the CEO of the Chamber. Jim Desmond scheduled, Supervisor Jim Desmond scheduled to join us today. As you know, things are crazy everywhere. So I think right now he's tied up with something. So I've got a text out to get an update. So just while you're all here, first of all, thank you so much for joining us. We started this power lunch last month with Dr. Neufeld with Cal State San Marcos, and just a really great opportunity to not only hear from some of our leaders in our community, but also an opportunity for us to help out with our member restaurants. So as you know, everybody that registered, it was Supervisor Desmond has joined us. Sorry, I beat you this time, Christina. Hi, Supervisor Desmond. Thanks for joining us today.
All right. Is everybody power lunched?
Yeah. So I just started giving just a little rundown of this event. And again, thanks for everybody for joining us. The $10 that you use to register for this event, you're going to get a $10 gift card back from one of our member restaurants. So just a little opportunity for us to help our members, help our member restaurants through. As you know, they've been hit harder, if not hardest of all. So appreciate you joining us today. Real quick, just the format of what we're going to do today. So as we get started, I'm just going to have everybody introduce themselves, and please tell us your business or your organization. I'll say Supervisor Desmond till last. After everybody introduces themselves, I'll introduce Supervisor Desmond, and after a presentation from Jim, then we'll have some time for some Q&A. I'm sure you've got a lot of great questions, and again, Supervisor Desmond, thanks so much for joining us today. I have so many people ask me one of the first questions about, what does the Chamber do? And I think more than anything, it's the access and introductions that we provide our members. So being able to have access to our county supervisor when he's going a million different directions, we certainly appreciate it. Okay, I'm going to go around as I refer to, our San Marcos squares. So I will start with Christina.
Hi everyone, I'm Christina. I'm with the San Marcos Chamber. I work directly with member recruitment and retention, but many of you more know me just as another friendly face here at the Chamber office. We miss having you guys here in person and are really happy to have you here today.
Thanks, Christina. Melanie?
Hi everybody, I'm Melanie Hamil with the San Marcos Chamber, and I'm the event director, and it's great to have everybody here today.
Stevie Ray?
Hi, I'm Stevie Ray Dykstra, Maypro San Marcos, professional home cleaning. Glad to be here.
Nancy?
I'm Nancy Whitson, owner and operator of Fresh Healthy Cafe, small cafe there in the New North City area.
Lana?
Hi, I'm Lana Cornell. I'm a board member of the Chamber. I'm also the new executive director for La Maria Senior Living.
Richard?
Hi, I'm Ginger Hitsky with Hitsky Development. I own apartments in town, and I'm a big fan of the Chamber and also of Fresh Healthy Cafe.
Stacy?
Hi, I'm Stacy Rungaitis, and I am the executive director for the Palomar College Foundation.
Kathy?
Hi there, I'm Kathy Carpe. I'm the Director of Development over at Casa de Amparo, and we treat and prevent child abuse, and we've got foster kids living here in San Marcos. Good to see everybody.
Thanks, Kathy. Heather?
Hi, my name is Heather Jenkins. I'm also from the same organization as Kathy, Casa de Amparo. I'm the Director of Donor Relations.
Natalie?
Hi guys, Nat War Photography, family photography, commercial photography. Super happy to be here and big fan of the Chamber as well.
David?
Introduce David. David is actually has a tax firm that we've used and also does financial advising. So I had asked if he would join us today.
Great, thanks, Nancy. Tomorrow?
Hi, everyone. My name is Tamara. I'm Community Engagement Coordinator with Vista Community Clinic's Tobacco Control Program.
Thanks again for everybody joining us today. It's great. I enjoy being able to have the opportunity when we have a group this size to be able to have everybody introduce themselves. I think it also gives our speakers an opportunity to see the wide range of people that are on the call and various organizations and businesses that you represent. So now at this time, I'd like to introduce Supervisor Jim Desmond, who's our County Supervisor for District 5, who's been a great advocate for small businesses throughout this pandemic and even beyond that. So as most of you know, Jim served as San Marcos Mayor from 2006 to 2014, was City Council prior to that, U.S. Navy veteran, got his bachelor's degree from San Diego State. Also, very important, a former board member of the San Marcos Chamber of Commerce. And recently, I think Jim recently retired as pilot for Delta Airlines. All right, with that, Jim, go ahead and take it away. Thanks again for joining us today.
Well, thanks. This is like old home week. I know many of you on here, and glad to see people back again. So glad to be part of this. I just got off a Zoom. It was 700 people on the Zoom I had at 10 o'clock this morning. So this is much more friendlier and manageable. So I appreciate that. You know, it's COVID, more COVID, unfortunately, so as you know, all know that we, as of December 28th, had 3 more weeks of the shutdown, unfortunately, and probably end up going past that date if we don't get our numbers back down. I will say our hospitalization rates they've increased, but they've maintained pretty steady in San Diego County. We're at about 78% of hospital capacity being used up, and about 82% below the, or 82% of the ICU beds being used. So regionally as a system, we're still in pretty good shape. Unfortunately, because we got lumped in with, as a Southern California region with, you know, most of the other the populous counties in Southern California, we represent about 60% of the population of California in the Southern California region. And unfortunately, Los Angeles County is not doing so well, but that, so that's kind of hurting our numbers and our efforts and kind of putting us all in this, I don't know, dark purple stage that we're in right now. So, you know, it's unfortunate the way we got kind of lumped in, but that's what we're having to deal with. Let's see what else is going on here. You know, I've always been an advocate for trying to make sure, you know, trying to keep small businesses going and alive during the pandemic. I've trying to do it safely. You know, I've always trying to advocate for all the health and safety guidelines as far as, you know, the masks, the distancing, the washing hands, telecommuting, all that kind of stuff. But I think, you know, our small businesses, at least outdoor dining and I mean, hair salons and nail salons and barbershops just got kind of swept up, even though there was no real, you know, evidence that they were the cause of the virus. So I've always been trying to take a kind of a balanced approach to where let's keep the businesses open, and if they can operate safely, you know, if big box stores and everybody else can operate safely, I think small businesses and you know, can do that as well. So it's been unfortunate, especially with, you know, people have taken all the protocols and they've, you know, put up plexiglass and they've built and invested in outdoor dining and things like that. And it's been kind of unfortunate that, you know, how it's been handled and in my mind, unfairly. But I went to Arizona. I think I went there in November and December. I went there for, you know, Sedona one time and then Scottsdale another time. And all their businesses are open. The restaurants were open, social distancing. They were wearing all the masks. They were doing all the, you know, the things you're supposed to do. And per capita, their numbers and our numbers are like within a percentage point away from each other. So I've always been advocating for that. Unfortunately, it hasn't really worked out that well. It was amazing if you're following the news there for a while that strip clubs were leading the way for restaurants to be open, which was kind of ironic. But unfortunately, that got appealed very quickly by the state, and I think then they got a stay put in place so the restaurants couldn't open. And I think that's going to be appealed. The hearing date is sometime mid-January. I'm not sure exactly when, but so there might be some light in that horizon. But in the meantime, our numbers are going up, and we got a lot more people testing positive. So we still need to follow by and adhere to all the safety protocols. And I'm noticing a lot more people, even myself, outdoors wearing masks and following those things. I had our Christmas and New Year's was very small. It was Carrie and I, and New Year's, we watched what did we watch? Ford versus Ferrari. So Carrie caved in and watched that flick with me. So I owe her a romantic comedy, I guess I have to watch for there. But so anyway, that's the stuff that's been going on, and we're just, right now, the big town hall. I did a big town hall today at 10 o'clock. And we had, I think, 700 people on this Zoom call. I was just hoping it didn't crash with that many people on, but it was about the vaccines and the vaccine rollouts and what the county's doing. And I had, I don't know if some of you were on it or not, but it had Nick Mascione, who was the head of Health and Human Services, and had some of the doctors there answering, questions. It was questions I read. We weren't able to take questions from all 700 people. But they had submitted questions, and I was asking them, and primarily about the rollout. And the big question that everybody has is, when can I get it? And unfortunately, we don't know when. I mean, it's really right now. It's going in tiers. Right now, it's the people that have frontline health professionals, doctors' offices, hospitals, and things like that. I had somebody call me up, and once they realized the janitor at the hospitals are getting it before other people. Well, somebody explained to me that the janitor in a hospital goes to more hospital rooms than a doctor does, and picks up all sorts of things. So it doesn't make sense to everybody, but San Diego County, I think they're doing a good job as far as getting out the vaccines that we have. What people don't realize, and I didn't either, I learned a lot on this thing, is that hospitals are getting their own shipments of vaccines, and health systems are like Scripps and Kaiser. They're getting their own shipments, and some of these are contracting with CVS to come to give to their people that are in their health care system. But it's all being done according to tiers right now, and so it's the 1A, they're in tier. There's different phases, and then there's different tiers within the phases, and then there's different levels within the tiers. It seems like they try to put everybody in the phase one so that you'd be happy that you're in phase one, but you could be way to the bottom in phase one. But I think they're doing it the right way as far as giving it to the health professionals first, and then the people, and then go to the senior facilities. They call them SNFs, senior nursing facilities. Making sure that they get it. The most vulnerable are going to get it. They also have criteria as far as like age groups and things like that. What they haven't got completely worked out yet is like a registration form. Like right now, the health professionals can go on the county's website and register their name, and they'll be notified of when they are going to, can get the vaccine and where they go to get it. We don't have a capability yet for the public to do that. They anticipate maybe as they roll out the tiers, then you'll be able to register. I actually suggested today that why don't we get ahead of that, and people can at least know they're in the queue, so that they, when your tier comes up, that you are notified by email, or you're notified, okay, if you're in phase 2B or whatever the heck it is, you are, go and here's the whatever, dozen or so places that administer the vaccine. So I was told also there's 2 different vaccines most people are aware of. And if you get the first.
Nope, you're froze. Can everybody hear me? Okay. But nobody can hear Jim. Okay. You'd rather hear Jim than me. All right. The life of Zoom. Was anybody on that? Jim's been referring to the vaccine rollout. Was anybody on that call earlier today? It's this quite a challenge, I'm sure. I wasn't on it either, so that's why I was anxious to hear from Jim.
Well, while we wait for him to come back, I mean, I've already found this to be really helpful because, you know, some of the stuff that he mentioned is on the state of California's COVID website. They have a, you know, a dedicated COVID website, and the tiers and all that was in there, but he really helped to fill in the gaps on,
Right.
you know, what they're working on next. Like, how do people get in line? Because that's what I'm wondering. I'm like, you know, how do I want my vaccine. I want to be able to get out into the world again. Come and visit my chamber peeps.
Right. Jim, I think you're back.
Yeah, I'm on that very good government internet. I think it was the Russians that just cut me out. The but thanks, Ginger. Yeah, you know, everybody wants to know when, and like I said, and the county's doing as best we can. The people actually that I mentioned that were at the doctors, Nick Mascione, he's the one who headed up the testing. And so, you know, if you need a test now, you can go get one. It's pretty simple, there's several testing sites and you can drive up and, you know, so he's the one who set all of that up, and he's the one that's also doing the vaccine rollout as well. So he's going to try to mirror that as best we can to, you know, when you know, maybe Cal State San Marcos might be a vaccination center, you know, like it's been a testing center. And so they're going to try to do that as best they can. It's just logistically, you know, nobody's done this before. There's going to be some hiccups. You know, I get a lot of phone calls from people saying, hey, you know, I have a delivery service. We deliver to hospitals. We deliver to prisons. We deliver to all these different entities. When can we get it? And I had people call me up and say, hey, I'm going in for cancer treatment, and I want to get the shot before I have to go into the hospital or the vaccination. And so it's, I have no authority to put anybody ahead of the line, and I will not jump to the head of the line either. But so we're going to send this video. It's an hour long, but we're going to put the video out on YouTube and things like that. So we got like 500 questions or more from people. We try to consolidate or bring them all down to about 20 or 25 questions, and so that was kind of well, that seems to be the news of the day, is the vaccinations and as far as COVID's concerned, and getting that out. One thing that, you know, unfortunately I'm no longer on Sandag. I got taken off Sandag, but the 78 interchange, hopefully, you know, right now Caltrans is soliciting public input on the project. There's dedicated funds, and this is the 78 and I-15 interchange. So what they're doing is the environmental report, which is sort of the first step of spending millions for this interchange, and basically taking the HOV lanes that come up the 15 and end right before the 78, that they would go over the existing interchange and land and end somewhere around Woodland Parkway or Twin Oaks Valley Road area, as so that you could get on the HOV lanes going southbound on the 15, or even going northbound on the 15, and then taking over the 78, because there's that bottleneck where the 15 and 78. So, I mean, it's going to be a long time before construction dollars are available for that, but at least, you know, once you start doing these environmental impact reports and spending money on the project, then there's a better chance of it, you know, continuing and going into fruition there. But, you know, I got a great staff, great team. If you guys have, you know, I'll take questions, but if we don't get to you, you know, I got a great team that my office is we respond to everybody, whether it's a yes or a no, or you know, I've made it clear we respond to all responses or to all questions, and at least, and if we can't help them, we can get them to the people who can. So don't hesitate. I work for you. I'm actually sitting in my Vista office. We have kind of a skeleton crew up here at Vista, you know, where everybody goes to jury duty at Vista. I'm in that building. Go up to the 5th floor, and that's where my office is. We're not really taking, I guess we're not doing in-person meetings, but it's all video stuff here on Zoom. But you know, if you got questions on anything, we'd be happy to, you know, get that out. I got one more thing is one thing we're working on here in North County also is the San Luis River Park. This is along the 76, a bikeable, you know, so basically it would be really nice if we could take that bike lane that you can get on in Oceanside and ride it all the way to the 15. But trying to get that San Luis River Park and trails set up and going there. Another thing I just want to throw out here, I'm rambling now, but the behavioral health and homeless issues. You know, before COVID, that was the focus, and it still is. But in North County, I was able to accomplish, and my staff quite a bit as far as behavioral health beds, and we call them crisis stabilization units and behavioral health issues. I was able to get 14 million bucks to Tri-City Hospital for them to build new psychiatric beds. They actually, because of structural things and things like that, had to close it down or temporarily close them down. And so I got them dollars to open up to build a facility with 16 behavioral health beds. Also in Vista and in Oceanside, we're going to be opening up these crisis stabilization units, which basically it's a 12 easy chairs, you know, where somebody who's in crisis, whether it's a homeless person that's screaming on the streets or it's some family. And there's a lot of families that have people that, whatever, you know, you got a relative that's going off the deep end and you don't know what to do with them. What do you do? Where do you take them? You take them to the emergency room, or the emergency room is normally if you're bleeding really bad, but if it's a mental thing, where do you go? So that's going to be these crisis stabilization units to where they'll admit them. And if they need to go to emergency room, they'll take them there. But to kind of get people stabilized, especially if they're on drugs or they need drugs or they need clothing or a shower or something like that, or just need to be kind of calmed down. We used to have to, our sheriffs and police used to have to drive people all the way down to Rosecrans for these types of treatments, or like the police call it a 5150 if somebody's just going berserk and they need to get calmed down and stabilized. It would take hours out of the officer's time to take them there. So there's going to be two facilities. Actually, there's one at Palomar Hospital already that we were able to fund, but there's also going to be one in Vista, one in Oceanside, and then in San Marcos, what's in the works right now. I worked with Summer Steffen, our district attorney. It was her project primarily, but I kind of helped her a little bit with it, is putting in a family justice center, which is basically, I guess, a place, for lack of a, I'm not a, whatever, this isn't my usual language, but it was, it's for battered women and children, a place to go. If you get, all of a sudden you're out of your house because somebody went crazy and you got nowhere to go, you need a restraining order, you need clothing, you need a place to stay, you need counseling. That's all going to be available in a one-stop shop in San Marcos, actually behind the current Ashley Furniture. So if you know where Ashley Furniture is now, Ashley only occupies about the first third of that building. There's a huge building behind there. So the county's going in, retrofitting and making that kind of a one-stop shop for North County, to where people and families in crisis can go and get help and services. There's something similar to it in San Diego, and this will be the first one outside of downtown San Diego. So my office and my staff in the county, we've done very well. No other district in San Diego County has gotten that much resources for behavioral health and mental health issues in the county. So I'm kind of proud of the fact that it's not all built yet, but and I know also with Casa de Amparo, we just had some grant money for Casa de Amparo and helping them out with their issues, and with Kathy Carpe and Heather. So I had, even though I'm a Republican, I still have feelings. And we want to do the right things for, for behavioral health in North County. So, all right, I'll stop and take some questions.
Jim, thank you. And thanks so much for bringing up the mental health issues, because, that's the thing too that I've noticed is, there's so many issues that we have as not just from a county standpoint, but from a society standpoint, and they don't just go away because of a virus. So being able to focus on those issues while this is all going on is critical. So thanks for everything you're doing with those regards as well. We got a nice small group, so this is great. So just someone to raise your hand and I'll call on you and you can ask a question to the supervisor.
Well, I was being polite. Of course, I've got questions. Well, first of all, I, as an advocate, as a homeless advocate, a renter advocate, it really warms my heart to hear the last updates that you gave about the crisis centers. I really appreciate your work on that, and I do remember the work that you did to get to work with Tri-City and the crisis that was, and so I appreciate your work on that. And I'm gonna find out what's going on with the center at Ashley Furniture to see if there's a way to do some permanent supportive housing at the Richmore Station project. So I'm glad. Actually, my question, since this is a chamber thing, I was coming here to talk business stuff. Obviously, you're hearing from a lot of different small businesses, as the chamber is, and I'm just wondering if there's kind of a theme that you're hearing from small businesses as a way that regular people can help out. I do my part. I buy gift cards and I'm constantly giving them away to people. But is there a way that like people like us can advocate to our local city councils, to the county, to our governor? Is there something that we can do more to help our small businesses? Is there a theme or anything that you're kind of hearing? That's me. That's all.
Well, I mean, it's I hear from the ones that are just about have to throw in the towel. The shop local is kind of the best thing, and going out to these places. But I talked to a couple of businesses in Carlsbad that they said that even when they have gone to takeout, they used to do whatever $4,000 or $5,000 a night in business, and now they're doing $200 or something like that, and it just isn't enough for them. I think I've been trying to advocate to get them open, or at least be open outdoors and things like that. If you could share your voices, if you agree with that at least let them be, and let other representatives know, because there seems to be, unfortunately, a pretty split divide on either closing everybody down or not. And what I'm hearing from some businesses is they're frustrated because they feel like they're being discriminated against, because why my business sector is doing this. And we kind of get it, with food and with sitting down at a restaurant is different than another type of industry. But outdoors, we should be able to manage those types of things. But I don't know, just spending your money like you're doing, Ginger. I think you're doing the right thing in trying to support them. So that, at least the carry out portion and things like that is really, we've been eating out. I've been finding new places that have good food that I, hadn't already gone to. So, just your support with that effort. And unfortunately, I think, a lot of these businesses, some of the restaurants are staying open. In Carlsbad the other day, they had a council member brought forward to increased punishment on those businesses that were staying open, because they had quite a few. And fortunately, Carlsbad did not say we should increase fines and things like that on these businesses. Kind of let it run the course of the cease and desist, and then go into the district attorney's office and seeing if she's going to prosecute or not. And they feel like they're like it's a discrimination. Is why me? Why I can operate safely? I spent all this money. I did all this improvements, and yet I'm still being shut down. The governor unfortunately hasn't given up on giving us those opportunities for local control or things like that. But I don't really have a good answer. I have to give you a political answer, I guess. But I wish I had more of a concrete keep spending your money, Ginger.
Thanks, Ginger. Thanks, Jim. Yeah, it's been such a challenge. I know from a chamber standpoint, we've been pushing the shop local as much as we can, trying to do events like this. The other thing is that all the chambers in North County work so well together. So we've collaborated on a lot of things to help push as hard as we can. I think we're fortunate in San Marcos that, our local leaders, our mayor, our city council, of course, Supervisor Desmond, Senator Jones, Assemblymember Waldron have all been really pushing hard too with the businesses. And the only thing we can do is to keep pushing.
Yeah.
Any other questions? Sean, do you have a question?
Thanks, Rick. Hi, everybody. It's Sean Feeney. Hi, Supervisor Desmond. I'm a huge fan of yours. I just want to say keep doing what you're doing. We're on the same team, and I wouldn't want to be in your shoes right now. So thank you for all that you do for all of us. I'm in the manufactured home business, Pacific Manufactured Homes, been for a long time, for over 30 years. We have 6 locations and growing, and fortunately we're essential, and thank God for that. And I'm sorry for the small businesses that are struggling and then that are basically going to be going out of business. But needless to say, I have a different topic to talk about. Because we're a small business, considered a small business, I hope it's appropriate, and it's regarding permitting. And I don't know, Supervisor Desmond, if you've been getting this or not, but I've kind of been sitting on my hands and sitting on the fence about it for many, many months, just hoping, trying to be sensitive and trying to be understanding and trying to just bide my time waiting to see how long these things are going to take, and wondering when, of course, COVID's going to ease things up. Long story short, as you know, we'll consider it the affordable housing business, and we have many, many projects out, either single family homes that are being built on land, and ADUs, as you call them now, or we call them granny flats, where it's the big push for ADUs, and the counties and cities have been very generous with their money is to contributing for permitting and so on and so forth. So the problem isn't any of that. The problem is that in a normal building situation, by the way, I've got 2 of my foremen sitting on either side of me that deal with the counties and the city permits on a day-to-day basis. So they're here for questions and maybe input, Ryan and Tim. But in a normal permitting process would take what, three months, give or take, to get a permit to build either an ADU or granny flat or a new build. And right now we're sitting on 20+ jobs that have been submitted since late 2019 that are still not even looked at, even addressed. Still don't have permits on any of them, and it's getting worse. I mean, demand's increasing, customers are stacking up, and the city of San Diego, county of San Diego are basically just sitting on these permit applications and ignoring that they exist. And here we are, some of them since, again, November of 2019, which puts us over 14, 16, 17 months. And it doesn't seem like it's getting any better. So I thought Rick and I spoke yesterday or the day before. I thought this might be the good forum to at least bring that up to you, let you know, even if you can lead us to the direction of what we need to do to at least light a fire under these people's butt, to get them to acknowledge that there's people out there that are standing with their bags packed, homeless, some of them waiting for permits so they can build their new homes.
Well,
go ahead. Who is that?
What's me? Desmond.
Hi, Joe.
Yeah, I'd be happy to, Sean. I've got actually 2 of my members of my staff, both came from the planning department. And so we know who's doing what and why. And what I'm going to do is I'm going to have my guy, Ben Mills. I don't know if you can put your phone number in chat or whatever, Sean,
Okay.
or I'll have him call you up. And if you can give him the specifics of these items, these, especially if it's affordable housing. I mean, we can help push that. We may or may not be able to make it happen faster. I don't know, the situation, but at least we can rattle some cages and say, hey, what's going on? And then at least get you the information as to why they're held up. And if not, then we'll say, hey, can you make these priorities and get them moving? That's exactly what I'm here to do, for people in your situation, and call my office. This is, I'm your representative at the county. So,
Okay.
you don't have to wait. You send an email. I make sure my team is very responsive to answering questions and getting you to the right people. So I'll have Ben give you a call today if he can do it, and if not, in the next day or so.
Thank you very much.
You're welcome.
Jim, that's the other thing I just want to mention real quick too, because your staff is great, and I've had several chamber members that have had issues that have reached out to us, and whether it's been anybody in your office has been so responsive. I know Crystal Javara has been great as far as connecting with our members whenever there's issues that they need help with. So kudos to you and your staff for that. Any other questions for the supervisor? It's a great opportunity. We have them right here in front of us on our San Marcos squares.
I have one. Just hi, Jim. Stacy Rungaitis here. As you can imagine, Palomar with 30,000 students that we're serving, all in a remote setting, it's been a challenge, just like everyone's industry. I was very interested in what you were talking about with the behavioral health, because we're seeing an increase in the need for behavioral health resources. We do have some of those within, internally, but is there a place I can go to find more information on these crisis stabilization units, and also the Family Justice Center that's coming, because that sounds like it's really close to our main campus, which would also be something I would want to make sure we alert our folks to as well.
Well, right now, the only crisis stabilization units that are open are at Palomar Hospital. And we helped, the county gave them extra money to kind of ramp those up. So right now, Palomar Hospital has them. I'm not sure. They're normally for someone who is in crisis right now, but they're not, they're not emergency room material, and you're not really sure what to do with them. There is one, and they take walk-ins and at the crisis stabilization units at the one in Vista actually should be opening up soon. There's actually an entity that's there that's just trying to enhance that. That's by the Ford dealership in Vista, and there's a company called Exodus that runs that. And but that's the city council. It still has to go through the city council. I think one more final approval by Vista City Council before that one. So that one will be opening up sooner. And then the other one in Oceanside is in the design process to be built. So unfortunately, and then same thing with the crisis or the Family Justice Center in San Marcos is not. We allocated the funding, but it's not under construction yet. So unfortunately, Palomar is like the only place right now for if you have a student that's in need and you don't know what to do with them, and you need and you're not sure, go to the crisis, have them, if you could get them to the crisis stabilization unit at Palomar. And if they need an emergency room, they have one right there. If they need other doctors or things like that. But a lot of times, like I said earlier, the emergency rooms are more they're not really for behavioral health, and they don't always have, I guess, psychologists or psychiatrists or the people trained on staff. They're more for healing up wounds right away is more their effort. And so I wish I had better information for you on that, but Palomar Hospital is a resource. So you might want to check with them, or maybe they can give you a tour of it or something like that, and get a better understanding of what they offer, and if it's a right fit for whatever crisis, whatever you're faced with. I wish I had a better answer for you, but it's not built yet. We got it approved, we got money for it, but it's in the works.
Well, I think the need will continue. So when they come online, it will be such a great resource for the community.
Yeah, especially with, all this stress and anxiety that we're going through with COVID here lately. One of the things that we've seen is almost a 4-fold increase of deaths by a drug overdose, and primarily with fentanyl, which I guess gets laced into heroin or cocaine or whatever it gets into. And there's been a lot of people, unfortunately, are coping with the anxiety of COVID and the lack of interaction and things like that with drugs and alcohol. And it's just not a good recipe. And so, yeah, and I can see what you're up against, but again, if you do have somebody, call my office, and I've got actually a person, Donna Cleary. I don't know if you know her. She's worked for several legislators in the past. She's my health and human service person who knows more about the inner workings of what the county has to offer, and a lot of my staff knows a lot more than I do. So I'm the policy guy. They're the ones that are more hands-on, and so be happy to link you up if necessary. All right, I'm going to have to run. Anything else or parting words? I'm going to have to get going, actually.
Okay, Jim, we appreciate you joining us today. I know you are busy, so thanks for everything you're doing for small businesses, and keep fighting the good fight for us. We appreciate it.
Thank you,
All
Jim.
right, thanks everybody.
Thank you.
All right, take care.
Happy New Year.
All right, bye-bye.
Just a reminder for the rest of you, as Jim goes, just a few things coming up. Check it out on our website. We've got Maximize Your Membership coming up next Wednesday at 10 a.m. This is a great opportunity just to learn, especially now with so many things being virtual, to help you maximize your chamber membership. Government Affairs is next Thursday at 8 a.m. This is also a great opportunity, similar to today, where we have Jim doesn't join us, but Crystal, either somebody from his staff is always on that as well, giving updates from the county, and we have updates from the city, sheriff's department, university, college, everybody. So make sure you attend that. And then, of course, I can't have a Zoom or can't have a meeting without reminding you, every Tuesday, farmers market from 3 to 6 right here in North City. So thanks again for everybody for joining us today. Thanks for being active chamber members, and stay safe and healthy. Thanks, everyone.